Good day, everyone. Our Ministry of Health has recognized pain as fifth vital signs as a strategy to improve pain management in MOH hospital. It is currently one of requirements for accreditations as a pain-free hospital. Thus, I'm here to bring the concept for pain as the fifth vital signs to all our pharmacy staffs so that we are moving towards pain-free hospital or hospital bebas kesakitan. We use the nurse slides by KKM as we are under same category paramedic. So before we start, everyone must memorize the policy statement on pain-free hospital. This is very important and commonly asked by auditors. So everyone must memorize in heart all the 5 policies. Firstly, we must recognize pain as the one of the vital signs and all patients must be assessed pain. To assess pain, appropriate standardized pain assessment tool must be used such as pain score ruler. After assess pain, healthcare providers should listen to patients' complaint and respond immediately to manage the pain. Lastly, healthcare staffs should be continually educated and aware about pain. The pain policy and PIAGAM PELANGGAN can be found in pain-free corner at the waiting area of OPD and MOPD. There are 10 criteria for pain-free hospital. Everyone should remember all 10 criteria as well because auditors will ask during the audit. The criteria includes have a written policy in hospital, all staffs implement pain as the fifth vital signs and manage acute pain following standardized treatment protocols such as WHO pain ladder. Train all healthcare staffs about pain, educate patients in pain management, regular audits on pain assessment and management, policy and guidelines, apply multimodal drug therapy approach in pain management, as well as incorporate non-pharmacological and traditional complementary medicines. This is the perkeliling by MOH to compulsory carry out pain as the fifth vital signs in hospital or health clinic. Auditors also always ask these 5 training objectives, so everyone should remember. The objectives are to improve understanding of pain, framework of pain assessment and management, ensure effective implementation, reduce barriers to pain management, and meet the objectives of pain-free hospital concept. So what is pain? Pain is defined as unpleasant sensory and emotional experience with actual or potential tissue damage. Sensory component is physical aspect, which means what patient feel physically, while emotional component include patient's emotion toward pain such as depression or anxiety. So for patient, they will only complain pain as sakit. There are different types of pain and can happen at any parts of our body. Pain can be classified as acute or chronic pain. We can differentiate acute or chronic pain depending on the onset. Acute pain normally is sudden and short duration, while chronic pain is even healed physically, the pain may persist. Acute pain has potential tissue damage, and severity depends on amount of tissue damage, which not happen in chronic pain. Acute pain is a symptom, but chronic pain may involve CNS dysfunction, so may be a disease such as cancer pain. Chronic pain has more psychological effects, whereas acute pain, the psychological effects will improve once pain relief. Examples for acute pain are surgery, burn, abscess, but chronic pain are cancer pain, post-stroke pain, or neuropathic pain. Besides acute and chronic pain, we can also classify pain as cancer pain or non-cancer pain, nociceptive pain with obvious tissue injury, and neuropathic pain which involve nervous system damages. By implementing pain as the fifth vital sign, we can provide the best service to the patient. Okay, why we put pain as a fifth vital sign? This is because pain is very subjective. Patients can only self-report to healthcare providers, as we can't read patients' mind. By listening to patient, this can provide two ways of communication and results in essential management. When patients say pain, then it is pain. We cannot query back the patient by saying, "Oh, I see you not very pain, you like." Okay, so back to our policies. We can carry out pain management appropriately. Everyone can remember all these policies, right? Then why we assess pain? It is because we need the baseline of patient's pain so that after treatment, we know whether patient is improving or not. Reduce complications and titrate analgesia treatment, and most importantly is we can document it. So you may ask, when should we assess pain? Answer is all the time and anytime, such as when we check vital signs, on admission, transfer in from other place, half an hour after served medicines, during procedures, and whenever patients complains of pain. And we assess pain everywhere. Everyone in the hospital are responsible in assess pain. Next is the approach to pain management. We use RAT approach. R stands for recognize, A for assess, and T for treat. Everyone must remember this approach. The first step, R recognize, is we must recognize patients having pain. We see patients if there is changes in behavior or facial expression such as shouting or crying. Then we assess the pain. We determine which type of pain, whether it's acute or chronic, nociceptive or neuropathic, cancer or non-cancer pain. For psychological pain, we need to ask patient why. Need to know their reason why they feel pain. Is it family not around or is it financial problem? Then we treat accordingly, such as can we use non-drug treatment or must initiate drug treatment? So what will happen when pain is not treated properly? If pain is not relieved, then will affect patient's cardiac system such as increased blood pressure, respiratory rate, gastrointestinal problems, or even reduce patient's quality of life. So like I said just now, it is important to listen and believe patient. We cannot shout at patient and scold them cheating. When we take patient's history, we can use PAIN approach, which is called pain approach. We can ask where is the pain, what makes pain worse, what is the pain score, and what makes the pain less. Then we document it. Which tool is suitable to use for assessment of pain and how to use. So we have to ask them and show them the pain assessment tool. There are 3 tools that we can use to assess patient's pain. Self-reporting pain by patient remains the gold standard and best method. Observer assessment is observation of behavior and vital signs of patient. Then let us see one by one. This is our MOH pain scale. When we ask patient, we ask them look at this scale from 0 to 10. 0 equals to no pain, while 10 is the worst pain you can imagine. What is your pain score? Can you tell me or point to me? Normally, this is used for adult or children more than 7 years old. Another self-reporting tool is the IASP FLACC Scale. IASP is International Association for the Study of Pain. This scale is used for children from 3 to 7 years old, but let them choose which phase they are having now. Bear in mind, we cannot emphasize on the numbers. We can only let them choose the facial expression they think they are for pain. However, what we always face is language barrier and communication difficulty. Patient. By looking at the MOH pain scale, at least they will know or understand what we're trying to ask. Okay. Another type of tool is the FLACC scale, which we use it to assess patient 1 month to 3 years old patient, as they are unable to express pain, so we can only observe patient's behavior and vital signs. FLACC is the first letter of each category. Besides pediatric, FLACC score can also be used in elderly patients or cognitively impaired patients. We observe their behavior for 2 to 5 minutes, then only can select the score and sum up. The more the score, the more severe pain they have. This slide summarizes which type of patient we use which type of tool. What about for those unable to assess pain score patient, such as in ICU patient, where patient is unconscious or sedated? Then we just record unable to score and write down reason. We cannot assume 0 score as the pain score. This slide shows the flowchart on how we implement pain as the fifth vital sign. When the pain score is less than 4, we can suggest to serve paracetamol and reassess the pain again later. If the score is more than 4, then we can always inform doctor and suggest appropriate medicines based on WHO ANALGESIC ladder. This is the nursing observation form. PS refers to pain score to be documented. Move on to the last part of the pain management. Pain management can be classified into pharmacological treatment and non-pharmacological treatment. Everyone plays a role in managing pain. Everyone in the hospital, including doctor, pharmacist, nurse, and other healthcare alike, and even patient, we form multidisciplinary team. This slide also very important. Auditors will ask components of pain-free hospital, so everyone must remember. 3 components for pain-free hospital are anesthesia and analgesia, which means our pharmacological treatment. Traditional and complementary medicines is the non-pharmacological treatment, or traditional medicines such as traditional Chinese medicine, which available in hospital kepala batas. But for our hospital, we only have physiotherapy and occupational therapy. And lastly, the minimal invasive surgery. Minimal invasive surgery means we provide daycare surgical intervention. We ask patients to come at the morning, done surgery, then observe in the hospital for hours, then if nothing happened, allowed discharge. Or we try to give minimal surgical interventions such as we do laparotomy, open 2 holes and do surgery, rather than open up whole stomach, take out whole intestine and cut the appendix, then put everything back. Non-drug treatment can be divided into physical and psychological, depending on which type of pain. Physical treatment such as RICE, RICE stands for R for rest, resting on bed, I for immobilization, reduce mobility and reduce inflammation. C stands for cold compression, use hot and cold pad to apply on pain area. E stands for elevation such as lifting up the leg after surgery. Others include acupuncture, massage, physiotherapy. On the other hand, psychological treatments are explanation, counseling for patient, educate caregiver for support. This usually done by psychologists or our psychiatric team. Example of non-pharmacological treatment is relaxation technique, reduce stress, reduce pain. Or appropriate positioning such as sleep on the left side to improve blood circulation. Psychological treatments such as relaxation, distraction, music, or show-guided imagery to improve patients' emotion. Another one is massage and acupuncture. We can also refer physiotherapy for elevation, ice therapy, or hydrotherapy, or refer psychiatric team for counseling. For nurses, they can also always check for other possible causes of pain, such as catheter blockage or swollen at the intravenous site, then inform doctor. For pharmacological methods, usually we use medicines like ANALGESIC to treat pain. This is the WHO ANALGESIC ladder, but this is the old type. The latest one I already put up at the pain-free corner at OPD. T Express there. Up there got one board. The content is similar but the diagram is different. Everyone can spend time go and have a look. For pharmacists, everyone must know what is WHO ANALGESIC ladder and management steps. For example, for treatment of pain at periphery site, normally we use anti-inflammatory drugs such as PCM, NSAIDs or COX-2 inhibitors, or local anesthetic agent. For spinal cord pain, usually we can use local anesthetics, opioids or ketamine. For pain involved brain, we use PCM, opioids, amitriptyline or clonidine. All of us must know how to step up or step down therapy and remember on the side effects and counseling points. So here is the quiz. Auditors will also ask these types of questions during audit. In acute pain, does opioid prescription has high risk for addiction? Answer is no. Addiction does not occur if opioid such as morphine is used for relief of pain. Patient may develop tolerance, but usually it's not a problem when we use in short term and when the pain heals. We can titrate to PRN gradually. Next is pain assessment should only be done when patients complains of pain. Answer is also no. Pain assessment can be done anytime. Everyone can refer back to slide number 17 and 18. Next is if pain relief is given to the patient regularly, it will mask all signs of complications or severity of the disease. Answer is no, especially in acute pain. where pain is the symptoms. We treat pain and at the same time we treat the physical injury. Next is acute pain patient who keeps asking for morphine must be addicted to it. Answer is no, as we have to titrate up when patient still having pain. But we reduce dose once the wound is healed and pain decreases. Acute pain should resolve in short period so addiction does not occur. Last question is during wound dressing, if patients complain of pain, what do you do? So answer is based on our policies. We recognize the pain, use appropriate pain assessment tool, assess patient's pain score, listen and respond to it, such as inform doctor to serve appropriate management, including pharmacological and non-pharmacological treatment. So in conclusion, everyone should know pain as the fifth vital sign. Implement and practice pain assessment. Thank you very much.